Listen to the fearless Auditor General, exposing governance flaws with sharp accountability.
You're gonna hear some opening from remarks that will shock you. This lady is fearless. She's fearless. Uh, she's punching above her weight when it's here in Parliament because she could have easily taken. She could have taken a road where she wouldn't. She wouldn't say cause an upset, but she did cause an upset because of the things that she revealed, and she doesn't pull any punches. It's just too bad that we don't see more of her, and we don't have more people like her. But here we go. Watch and appreciate the brilliance and the courage of this woman.
Yes, we'll ask you to respond with brief opening remarks before we go into the details. So, Madam Auditor General.
Thank you, Mr. Chairman. I take it that you want me to speak to the matter in the annual report, or do you want me to speak generally?
Well, there are three sets of issues we're going to be looking at: the annual report for 21-22, the compliance audit compendium report, and also the performance audit. We're going to take them in order, but you can, as I said, just generally, because they're going to be, I know, a lot of questions on each.
Okay, Mr. Chairman, I'll set the context for our reports. As is revealed in the annual report, the compendium report representing the review of the COVID-19 expenditure by the Ministry of Health and Wellness, and to some extent the performance audit report, there is evidence that there is significant room for improving the accountability and governance process at the Ministry of Health.
You hear that? Significant room for improvement. What shall I say? Them a feel over there. They're feeling.
And I say this against the backdrop that, as you will see from the annual report, the recurring issue of the absence of financial reports. And now these financial reports are not only required by the Constitution, but you will appreciate that every organization must give account for its stewardship over the financial resources allocated and in our case, appropriated under the Act. In this case, the Ministry of Health has been found wanting for a number of years. The 2022 report speaks to a 9-year deficit, and a table is provided. Mr. Chairman, I also want to bring to your attention that the Ministry has responded to say that action is being taken.
People, I want to pay close attention. Whatever you do, stop for a second. Just listen to this lady. How she could just lay it out cool and calm. Just listen to how she lay it out. And how she going to tell you about the excuses for them get every year in terms of providing paperwork showing where the money went and the purposes for the money. Let me go back a little bit.
To address the deficit, and we should be provided with the accountability and governance process at the Ministry of Health. And I say this against the backdrop that, as you will see from the annual report, the recurring issue of the absence of financial reports. And now these financial reports are not only required by the Constitution, but you will appreciate that every organization must give account for its stewardship over the financial resources allocated and in our case, appropriated under the Act. In this case, the Ministry of Health has been found wanting for a number of years. The 2022 report speaks to a 9-year deficit, and a table is provided. Mr. Chairman, I also want to bring to your attention that the Ministry has responded to say that action is being taken to address the deficit, and we should be provided with the appropriation accounts in soon order. However, the ministry gave the same commitment in 2018. In fact, the annual report for 2018 said that the ministry has since indicated that the outstanding appropriation accounts will be completed by the end of the financial year 18-19. 18-19 passed, no appropriation accounts. 19-20 passed, no appropriation accounts. 2021, the ministry provided an additional reason in the frame of the challenges with the Finman system, but indicated that it had been resolved and the accounts were with the internal auditor to be reviewed. Well, 2022, we received the same explanation with the same promise to present the financial statements. Now, we're talking about in total $560 billion, Mr. Chairman, for which the ministry has not fulfilled its financial and fiduciary responsibility to provide a report on. They just give a synopsis as it relates to the COVID-19, which I believe the same weakness in the financial governance arrangement is revealed in the expenditure process for the COVID-19 expenditure. And let me just hasten to add that I do understand that it was an emergency, and of course it was unprecedented, so the ministry was expected to respond in a manner that it had not responded before or be called on to respond. However, that does not negate the need to ensure that the expenditure meet the requisite guidelines that exist and that accountability and transparency is preserved. I also want to indicate that the audit of the COVID-19 expenditure was executed in June 2020, having advised the ministry in May 2020 that we were going to execute the audit. And the purpose of that audit is not to castigate the ministry, but recognizing, as an Auditor General, recognizing the emergency situation and the likelihood that controls would be relaxed and the significant sums of money involved, because we're talking about over $8 billion that was allocated to the ministry to execute its responsibility under the COVID-19. We used the audit as a means of a preventative and a corrective measure. And so it was, whereas we did not do the real-time audit as we did for the COVID care program, I commissioned an audit that I call a near-time audit, because we just didn't have the resources to do a real-time audit as we did in the other cases. So the aim of this audit really was to identify weaknesses and provide guidance to the ministry. I believe that the cover letter that we sent to the ministry, setting out our intent to audit the expenditure, actually provided, in my opinion, the expectation, something as basic as contracts, which is going to be maybe a contentious issue here this morning, Mr. Chairman. I gather that the Permanent Secretary will address his own views on that. But overall, we're talking about 619 million, I think, as at March 31st, 2021, plus 124 million for infrastructure payments that were made, that I just cannot conclude that I'm satisfied that the systems were in place and the evidence exists that the government received the value for all the monies spent, Mr. Chairman. And that's really the crux of the matter. As it pertains to the performance.
We don't need to say nothing more. No, that's a true professional right there.
Yeah, but you listen to her talking in Rattigan, and she's talking about all this money that has been appropriated to the ministry. And it's, in a nutshell, it's basically show me the receipt. Because you show the receipt, it's supposed to match up with the money that was spent. That you gave $100 million, it's supposed to itemize, a receipt supposed to show what was spent where, when, who got paid, all of that. So she basically did not get the receipts to prove that. So when the word unaccounted is used, no one is saying the money was stolen. It's just that they have no proof of how the money was spent. It's as simple as that. But, bringing up COVID, and here is where the problem is with this government. COVID was a pandemic, right? Then you had burial, and now you have Melissa. Do you see a through line there? Money was unaccounted for in COVID, money is accounted for in burial. Now we're going to have Melissa. So can you imagine what her report is going to be like for Melissa? Because I'm sure there hasn't been any closure with regard to COVID. And no one is talking about the amount of money that the government borrowed for burial. And here we're now talking about monies being borrowed for Melissa. So all of these things combined show you a broader picture of a government who just run amok with corruption. And they tried to get rid of her, right? They tried not to get rid of her. They tried to fire her because they wanted to
After the Integrity Commission, they wanted to get rid of.
Integrity Commission, yes, because they were saying, but she's a valued part of the Integrity Commission because her reports are essential to their investigations. So wanting to take her off really, is concerning. But listening to her speak, she's a consummate professional. And in the words of the Prime Minister, she's not afraid of nobody. You understand?
Yeah. I think she was very cordial, but she was using words.
She was matter of fact. Yes, she was matter of fact. And like they say, one is entitled to their own opinion, but not their own set of facts.
True.
And they cannot dispute the facts. And when she talked about contracts, market me comes to mind. Market me comes to mind because there was no need for that $80 plus $85 million contract in the Ministry of Health for what that company did, because they already had a company in the Ministry of Health tasked with doing all of those things that Market Me was doing. So it was like a double billing. It was unnecessary. So you can see now where monies really are just going out and nobody seems to care to make sure their reports are written, and in their reports they have their receipts to match with the monies that come out of the ministries. And that is a major problem, because he talked about the $100 and something million for infrastructure. Infrastructure, in essence, is the fixing of hospitals. When you look at the condition of the hospitals, the videos are there. Are they not seeing the same thing that we are seeing? Are so many people telling lies? So we can see that of a truth. So there's something missing there. There are many missing links because the hospitals are broken and the money is not accounted for. And again, no one is saying the money was stolen. People are just saying who got the money, how it was spent. And like she said, she doesn't see where the government gets value for money. And, if the government really had any integrity, they would put more money into the office of the Auditor General and to make sure she do her work, because she is on top of her game. And she's trying to save the government money. She's trying to save taxpayers' dollars. So to come after her the way they have been is really a sad state of affairs. And it's an indictment on the government for doing that. Because she's